So good morning, I'm Catherine Thompson and I head up the cardiovascular disease prevention programme at Public Health England. And today I'm really delighted to say we're joined by a few guest speakers. So we've got Gareth Walsh and Tracy Hemborough from Cornwall, and we've also got Georgina Crossman from Medway. And we're going to be talking today about some of the approaches that they've adopted in recommencing the delivery of the NHS Health Check programme during the really challenging context of still having to deal with COVID-19. So this is this webinar is intended today to give you some food for thought. Clearly, our response to COVID absolutely remains a priority, and we've got the new challenges brought with that of obviously delivering the vaccination programme, which remains very much the priority for the work of PHE, but clearly also local implementation. So these presentations today are here to give you some ideas and some thoughts to take on board, really, when you're starting to think about recommencing your local service at an appropriate time. And in addition to these examples, we do already have some guidance which is published, our restart guide, so you can have a look at that for further information about some of the things that would be really important for you to consider as and when you decide to get that service back up and running. So we've got an hour for today's session, and I'm going to hand over to colleagues from Cornwall to start off with. Really looking forward, Gareth and Tracy, to hearing about what you've been doing.
Thank you very much. Hello, everybody, and thank you, Catherine, for that introduction. So I'll tell you a little bit about myself, and then I'll let Tracy to mention her role, I guess, later. So I work for Public Health in Cornwall Council, and I lead on the NHS Health Checks, and I also lead on tobacco control. So what I'm going to do is maybe give you a brief overview of NHS Health Checks in Cornwall, and then we'll probably look at the detail of the project, our case study. I'm actually going to take my screen off to preserve bandwidth at the moment. Bear with me. Right, okay. Could we go to page 4, please? So hopefully everybody can see this slide on page 4. So NHS Health Checks in Cornwall. Cornwall has historically had low NHS Health Check offers, though the uptake for Cornwall has always been around the national average, which is for Cornwall is 49% since it started. Over the last few years, however, the number of those invited for an NHS Health Check has gradually been increasing year on year. And we've had more practices, typically predominantly a GP provider service, signing up to the scheme. Obviously with lockdown, that abated. And so to put it into context, in Q2 of this year, we delivered about 20% of what we delivered in Q2 last year. So although NHS Health Checks have unlocked, obviously it's a fifth of what we did expect from last year. So Cornwall, although we've had low numbers and they have been increasing, we've done lots of innovative work with priority populations. So one of those is a dedicated advisor in workplaces. So we have a full-time advisor who works with routine and manual workplaces and predominantly male-orientated, male-dominated workplaces. What they found is that the health checks is a very good way in to engage with workplaces, to get people thinking about obviously improving their health, but wider to get the workplaces involved, and they can sign up to workplace health schemes where they can have, in-house stop smoking service support, get active challenges, healthy eating challenges, and similar. In addition to this, we've also got a healthy lifestyle advisor who works with the CFIT programme. This is working with the Fisherman's Mission and the Fisherman's Hospital. This is a dedicated post working with fishermen, and NHS Health Checks is the driver for that programme. In addition to this, we've got pharmacy provision. So in the areas where there's not currently GP provision for a variety of reasons, app just prior to lockdown, and unfortunately we haven't actually activated them, but certainly in the new year we are looking to do that. And then I think finally, it's worth mentioning, there's addiction services in Cornwall, and we do work with them, and they are able to give NHS health checks to this priority population, and we're able then to signpost to stop smoking services. In fact, an in-house stop smoking advisor there, and they're currently working at a vaping project with that population. Finally, before we move on to our pilot piece of work, is I'll mention that Healthy Cornwall, although they're not delivering health checks at the moment, they are doing something called virtual lifestyle assessments, which is the behavioural aspects of the NHS health checks. So no physiological checks, but amongst these behaviour changes, so for example, stopping smoking, healthy eating, physical activity, they also have a mental health questionnaire that they ask. So they use the GAD2 and the PHQ2 as well, and over a certain score they refer to Outlook Southwest, which is mental health support. The feedback so far with this virtual offer has been very, very, very positive. So that's a summary really of an overview of the NHS health checks in Cornwall. If you could now go to page 5, please, and I will ask Tracy to introduce herself and take over. Thank you.
Hi, I'm Tracy Hembrough. I'm an advanced practitioner down in Penzance in Cornwall, and one of the partners in the surgery. I like to think outside the box. So when lockdown happened, health checks were deprioritised to all providers, and we were asked to cease activity at that stage. So we put a stop on them. Then at the end of June, when things started to calm down, we were told that we could start doing them again. But obviously there was a huge anxiety amongst these patients that they didn't want to come into the surgery. Everybody was still in lockdown really. So we decided that we would use a drive-through to see if that would work. And it's been really successful. So I was just going to talk you through how we actually did it. We sent invites to all our patients in alphabetical order, so did them in blocks, not knowing if people would turn up or not. We were very under the impression that actually they probably wouldn't turn up because they didn't want anything to do with healthcare at that time. However, we were absolutely flabbergasted that so many people would, accepted the appointment. So how we did it was on a Friday. We send invite letters, and patients would ring up and book an appointment, which they were given an appointment slot on the Friday and then on the Saturday. So on the Friday, they were given a telephone call, and everything was done over the telephone. So given healthy lifestyle advice. We asked them for their height and their weight, talked to them about all sorts of things, smoking cessation, healthy living, and these appointments lasted about 10 to 15 minutes. They were then given an appointment slot the following day for the drive-through, where they would have where they turned up through the car park and had their bloods taken outside. They were told to arrive on the day, and they would attend station 1, where they would have a full blood check done. So we did their HbA1c, their cholesterol, kidneys, full blood count, and we also offered serology testing at that point, which was a real carrot in front of them. So most people said, yeah, I'll come if I can have a serology test. Our nurses were in full PPE and outside in all weathers at times, very often in the rain, but it worked well. And then they would go round to the next station and have their blood pressure taken. So we would have a full range on the Monday, and then the results would all come back on the Monday. On the Tuesday, then a nurse would phone the patient. I think I'm on slide 7 now. They would all phone the patients with the results and talk to them about what the results showed. So if they needed to come in for anything else, or if their blood pressure was out of range, we would then book them other appointments. I thought I'd just give you a few figures as to what we'd actually done. So we've done three from June till now, we've done 316 health checks through drive-throughs, and only 8 people didn't attend for the appointment. I think that was probably because on the Friday we'd contacted them and had some conversations, so the following day they would then come in, so it was very few people that didn't turn up. We've identified 18 new diabetics in that range, 14 hypertensive, 4 new AF, and we've started 28 people on statins. So in that 6-month block, it's obviously really, really worth doing. Obviously the weather now is not so good, so it's more difficult to do. So we're looking at putting a gazebo in the something that we can put up and down at the weekend, so that our staff can work under that, because obviously taking blood and doing blood pressures in the pouring down rain, as you can see from that picture on slide 7, is often very, very difficult and challenging for them. But they always work with a smile, and it worked really, really well.
Great, thank you, Tracy. That was and Gareth. That was a super summary. So now we're going to hear from Georgina at Medway. So we'll move on to the next slide. Georgina, over to you. Thank you.
Thank you, Catherine. Hi, everyone. I'm Georgina Crossman, and I am the Programme Manager for the NHS Health Checks in Medway. In Medway, we're a commissioner and provider for the NHS Health Check. So we support the GP practices who deliver the programme, but we also have our own core team working within the department as well. So could I please move on to the next slide, slide 10? Okay, so obviously we stopped the programme, as did everyone, in March this year. Our discussions around restarting the NHS Health Check first happened in June, and this was prompted really by some GP practices expressing an interest in offering the service again. In addition, there was increasing evidence emerging around the links between CVD risk and COVID outcomes. The NHS Health Check programme is referenced in the COVID recovery strategy, so it became clearer and clearer how important our service was going to be. In one of our towns, so Chatham, we have a venue. It's called the Smoke Free Advice Centre, and this was a good opportunity for us, as it's our own building which we could use for health checks. So we looked to make that COVID secure. Also, looking at our IT system that we use in the GP practices, we could see a fairly quick and easy way to target our approach to inviting patients. So some of the questions that we asked ourselves prior to planning our restart of the programme included, where is the greatest need within our population? Which practices will be able or willing to engage with us? Do practices have the capacity for clinical follow-up appointments? What could we do a bit differently? And do we have an opportunity here to share some other important health messages? So if I could move on to the next slide, please, slide 11. So although we'd heard from a few GP practices who were keen to resume, there were still many that we hadn't heard from. So we sent around a survey to establish readiness to restart. There was a very mixed response from this, and still now some that we haven't heard from at all. About a quarter of GP practices indicated that they would be able to deliver now or in the very near future. And about another quarter requested support from our public health team. So it became clear that our support offer would need to be tailored to suit individual practice needs. So, for example, either inviting their patients to our own venue for patients' health checks, or having one of our own core team advisors deliver from a surgery. So on the slide it says outreach delivery. That's just, we kind of use the term core team and outreach team interchangeably, so that's basically what we mean. We have been unable to restart outreach in the true sense of the word, but the outreach team within Medway Public Health are completing checks as a result of invites from GP practices. Next slide, please. So slide 12. Okay, so prior to starting delivery, we had to ensure that our service was safe. So for the GP practices ready to resume, we asked for confirmation of adherence to the Health Check best practice and programme standards as per our normal SLA. But we also asked that they could adhere to the GP SOP for COVID during Health Check appointments. And that was obviously only once the national guidance allowed for the restart. So for us in the public health team, we went through the process of our venue becoming COVID secure. We met with the health and safety advisor from the council, and we produced a pretty long list of all what we needed to do. So that included things like clearing any clutter from the venue, installing hand sanitizing stations, establishing maximum numbers that were allowed within that venue, all the signage. There was just so much to think about, and more than we anticipated. There was things like what air conditioning system we were running, whether we could have a visitor's book, things like that. So when we'd finally completed all the work, we were audited and signed off as COVID secure. And we eventually achieved that literally a week before our planned restart of Health Check. So it's getting a bit tight. Risk assessment. So we obviously had a risk assessment for the venue, and we did risk assessments for staff as well. The council provided a COVID return to work risk assessment for staff. And in addition to that, any staff from higher risk groups, we did a more in-depth risk assessment. And we produced quite an in-depth SOP, so standard operating procedure for delivery, and that included things like processes for delivery, staff training, triage, IPC, cleaning, response level, so outlining if, when and why we might need to cease delivery once again. I think the SOP is an ongoing piece of work, as there's always updates and new guidance coming out. So for example, the change in the tier system and the lockdown, always updating it to make sure it's current with the current situation. As part of this, we considered different processes or different ways of working. One that's been talked about a lot is digital checks or two-part health checks. Our software did allow for this to be possible, so it was something we looked at quite a lot. Eventually, for us, we decided against that approach, and that was mainly down to concerns about being able to contact patients following their measurements. So the initial idea was to take measurements and then have the conversation part of the health check over the phone afterwards. And we were worried that once people had their measurements, how good would uptake be for that conversation, and we would consider that to be the most important part of the check. So we stuck with a face-to-face full appointment, but we did agree to monitor any feedback and reconsider if we were getting any concern around appointment times, which we did increase to 1 hour to allow mainly for the PPE and cleaning, which was kind of more than we would have done before. But also we were anticipating people wanting longer conversations or perhaps having more health concerns as a result of the lockdown. Something we did add into our check was an awareness raising element for the flu jab. It linked in well with the health check, and it was a very brief intervention, but we considered it to have a potentially big impact. Another new part of the health check is obviously the PPE side of it. So that was something that was quite a big change for our advisors delivering the check. Next slide, please, slide 13. Okay, so we lost about 6 months of delivery this year, so a targeted approach is essential for the remainder of this year, so 2020-21. Considering the link between CVD risk and COVID outcomes, we made the decision to target BAME patients and also the 20% most socially deprived. Our information team within the council looked to see how this could be possible. They consulted with the company who provide the software that we use in GP practices, and they swiftly deployed an audit to allow to filter for these patients, which all happened very quickly, and it sounds great. However, we have had some IT issues which are ongoing. So as a result, more than half of our practices weren't able to use this audit, and therefore our project officer who supports the GP practices delivering the programme, they worked really hard at producing an EMIS search to try and replicate what the new audit would deliver, and that was a big job. But it is being used now, it's been quality checked and it's being used successfully. So we communicated the approach, and initially we did have a couple of concerns raised about the PU approach. Some of the concerns included, were we missing other high-risk groups, and would that lead to an inequality elsewhere? And also some concerns that we were being too COVID focused, and was this taking away from the kind of usual focus of the health check? So we reassured everyone that as it's a 5-year rolling programme, all eligible people within that 5-year cohort will still be invited. It's just that this year's approach needs to be different and we need to target our resources. We produced a rationale document for restarting with this targeted approach to support communications around this. And at first, we did agree a target that 80% of the new audit should be invited this year where possible. Obviously, due to the IT issues that I mentioned, the where possible became quite important, and we had to be really careful about how we communicated this. Because of the IT issues, we can't necessarily hold some GP surgeries to account for that. Next slide, please. Okay, so moving on to our marketing. Our head of health improvement within the council is leading on COVID BAME social marketing work for Kent and Medway, and we've benefited from the insights from this. It was a common theme that healthy lifestyle was viewed as protective against COVID, and something that people wanted was culturally sensitive messaging for things like the NHS Health Check. 3 key pieces of advice for when communicating with the BAME communities were short, concise, and simple language, different languages, so marketing in different languages, and use of images. We also changed our marketing message slightly from a more blanket approach to more along the lines of, if you've had a letter, go to your appointment. So that was with the hope of trying to support uptake from our more targeted invites. We focused our marketing and comms on areas where we knew invites were being sent, again to try and support that uptake. And we also targeted our social media advertising, so it was targeted at areas and at different communities. Next slide, please. Okay, so how's it going so far? So the health check, we started on the 14th of September. The more up-to-date figure is that in our core or outreach team, we've now completed 357 health checks. I had a quick look yesterday and our software indicated that we've done 150 in GP practices. However, because of the issues that I keep mentioning that we're having with that software, it's likely to be more because we know we're not capturing data from some practices. we've invited 30% of the checks that we've completed have been with BAME patients, and that compares to 18% last year. So that indicates that our approach to trying to target the service is having a bit of an impact. There's still many GP practices who aren't able to engage with us. And obviously now we're within winter pressures and we've got the COVID vaccine coming up. So potentially that won't change for a while longer. We have now recruited, so hopefully our capacity will increase from early in January. And again, I've mentioned our IT issues way too many times, but in addition to the IT issues in GP practices, we've also had some issues with the software that we use in outreach. So that has also caused us quite a bit of disruption. We're hoping to be on the other side of that, touch wood. So yeah, that's my update. Thank you very much.
Wonderful. Thank you very much, Georgina, and thanks to all of our speakers for your sharing your learning and your experiences in remobilising the NHS Health Check service. That's been fantastic.